Hello, this is Sandeep from Suno Radio Network. We all have been through some heavy days lately. Well, having said that, things are all under control and we don't have much of tensions. But then some of us, especially parents among us, obviously have been set back their minds through some laid backs. And when I say about that, my heart goes down for those kids out there who really think or who really have that trauma not out of there. Well, we are fortunate to have with us Dr. Srinivas from Brite Medical Center. Welcome, Doctor. Doctor, these days I would say everything is under control and we know the situation is safe here in Qatar. But then thinking about the kids, somewhere or the other, I feel like, yes, they kind of go behind small noises, and also it's not easy to convince.
Right.
So what exactly goes around there?
See, this is something actually parents are worried about. So the war has affected many children and they are all anxious, scared, especially the younger ones. But the main thing to understand here is children won't process the events like an adults. Because their brains are still developing, especially the emotional part.
Okay.
They will behave in a different way. So take for example a loud sound. It will be registered as a what we say a fearsome memory rather than a simple past event.
Okay.
Getting it? So they don't react to what is actually happening, but they usually react to what their brain has learned before. So that is why even though situations are controlled here right now, they still think the danger is out there.
Okay.
So even a simple airplane sound can trigger the fear in them.
All right. So what kind of assurance, because parents, whatever they're giving now, I believe it's not assurance, it's reassurance.
Right.
Still, if the reassurance is made, things goes out to be wrong.
Exactly.
So why is that?
See, here there is the main problem is not lack of reassurance. The children's brain has learned that fear so deeply, so even simple reassurance is not enough.
Okay.
So basically I want to say reassurance works at a logical level, whereas this fear lives in the deeper emotional parts of the brain.
Okay.
So we cannot remove the fear with a simple logical reassurance alone.
Okay, so what exactly is the solution for that? Like when you're saying it's not the solution when we reassure,
Right.
So if reassurance is not the thing, then what is the solution?
See, here the main thing is a conditioned fear.
Okay.
That is not a random reaction. So whenever these children, they actually link this together, sound and danger. So if they hear the similar sound, the same fear loop triggers in them. Okay. We have to break that loop somehow using some techniques, which we call them as a brain rewiring. Okay. So there are two prominent techniques. The first technique, we will call it as a guided visual approach, where we expose the children either naturally or artificially using the televisions to the same sounds. Okay. So during step 1, we will assume or we will make sure same sound appears in the television, like some airplane taking off with loud sound. Okay. We let them observe naturally.
So it's basically like facing the fear.
Yes, exactly.
Okay.
Yeah. The second step, we will connect it to the sound, and then we will say, okay, this is the same sound that is coming from the plane, but it is loud, and we will say it is safe. We reassure them and we reframe them. Okay. But in the fourth part, we should connect it with some kind of action thing. Like suppose we will say to the children that if whenever you hear this kind of loud sound, you just simply say bye-bye to that plane.
Okay.
So we are making them believe that whenever this sound comes, plane is taking off. So from these steps, we can say we are converting actually a fear thing into an actionable pleasure thing.
Okay.
This is step 1. Coming to step 2, we call it as an emotional anchoring, where we are bringing together reassurance and the positive emotional behavior in their family.
All right.
Okay. Assume, suppose when everyone is in the home, suppose if they hear some kind of a loud noise or a plane or even a warhead going above our heads, they will simply rush to us and they will look at the parents. So as parents, if they stay calm, like they should be they should be calm, having normal routines with some pleasure talks. They can even distract the children with some playful tones. So whatever the child feels, the child calmness, it is a mere reflection of the parents' calmness.
All right.
Okay, so this is the step 2. So the crucial part here is the repetition, because many times what the parents say, they simply test for 2 to 3 times and they immediately expect the results and they give up. That's not should be the issue.
All right.
Okay, so the continued exposure itself is the main key role here. So what I can say as a whole is a simple 4R approach. We have to recognize the R for recognize the fear. We should regulate the fear using the first 2 techniques. We should re-exposure the children to the same again and again. Thereby we can achieve the rewiring to build some positive associations.
But doctor, okay, I am someone who had this fear of darkness. Okay. But when you say you should expose the kid to that fear to get that fear out of you. But I was not able to do that when I was a kid because I was so damn, worried about going into the darkness. So how will you handle situations like that? Like if a kid is not okay to get exposed to what you were.
No. The exposure should be in a controlled environment.
All right.
Okay. The predetermined things should be there itself. So this is a kind of mini experience rather than a full-blown layout. It's same like a learning swimming. Okay. Suppose we cannot remove that fear of water with explanation alone.
Correct. Yeah.
We have to let the child to experience water, but it should be in a controlled environment like a swimming pool rather than an ocean.
Okay.
That we have to.
So it's like we make the kids understand that there is safety, but then they are controlled and let into the danger.
Suppose if we have to experience the same darkness in the home, we will switch off the light. We will keep a dim light.
Okay.
It should be a gradual thing, not suddenly like switching off the light. Then the kid should not be normal. It should be gradual. It will take months to train for this.
All right. So what about kids who are going to school? Because these days, I think it's not easy.
Right.
Like again, whatever you were saying, when parents are there, it's like, okay, they trust their parents, but it's a different scene in the school. Right. So how we will handle situation if a child has some or the other issue in school?
Okay. So we will approach in a 3-step manner here. Okay. So we should train the students before going to school. We should address when they are in the school, and after coming from the school also we have to address.
Okay.
So before going to the school itself, we should train the students, children in such a way that if you ever hear any this kind of sound, you do simple like 3-3-3 rule. Okay. Like suppose, imagine 3 of our family members.
Okay.
Or count 3 numbers or move 3 objects.
Okay.
In that way, the child should distract his or her brain from that sound.
So it's basically like when you get angry, you count down to 10.
Exactly, the same. Okay. And at the same time, if we have to say, if you are getting fear, then you should inform to the teacher.
All right.
During the school, we should make sure that we explain the same thing to the teacher.
All right.
Okay. Suppose if the same sound happens again, teacher will reassure on that instant time, so that the child will be normal and the same scenario will be neutralized at the same point of time. So by that time, child is already doing his 3-3-3 rule. Okay, so their brain was actually relaxed, thereby reducing the fear of this sound coming down. Yes.
So, it's a time-taking process.
Obviously.
It could be because it depends on each environment the kids and the environment the kid is in.
Right.
So obviously, like if I may ask, how long it will take? How long, as in what would be the maximum frequency that you would say?
So it all depends on the child and their behavior. For normal children, usually it will be rectified in a few days to weeks itself.
All right.
Okay. For a little bit sensitive child, it will take even few months. But it all depends on the consistency, how their parents are actually
Training them.
addressing the issue. Like different factors will play into that.
At what point they should bring the kid to a clinical, maybe like a doctor or a professional who can take it? So what is that break point or pinch point, if I may ask?
Everything should be a limit, right? If they are getting some nightmares or any sleep terrors, any schoolistic performance is affecting, or the fear is being persistent for more than 2 to 3 months, then they should definitely visit a clinical psychologist.
Okay.
Child psychologist to be precise.
So this might, you're saying like it can affect the academics and also
Obviously
the non-academics, like when
Everything.
the kids are not going out, we should
Yes.
take a look into what that
Right,
as well.
right.
All right. So if it all, okay, I think everything is linked, but then if I may ask, like if such a kind of thing is happening, or if any situation, not just this, but any situation in life, could be personal, what should parents do in that point, at that point of time?
See, regarding the precautionary measures, they are usually very simple, but they are little powerful also.
Okay.
Okay. So you should not discuss any war-related or any trauma-related things in front of the children. Even if the things are happening outside, they should react normally. They should do their routines normally. Otherwise, the same will be reflected in their children also.
Okay.
So basically, children don't need perfect explanations, but they need some what we say controlled, emotionally controlled environment. That's all they can say.
So if it is not recognized, or maybe it is not, if the parents might be busy, or maybe a number of reasons, if it is left unrecognized, what would be the consequence?
See, sometimes it all depends on the amount of fear they are having at that point of time. If it is a mild fever, they will restrict only to certain activities and they will be free with some other things. But if it crosses certain point of time, they will not only affect the scholastic performance, they will prefer to sit alone, they don't want to spend time with others, they don't play, like everything will be affected.
All right.
Okay, that is the point of time where some things might go wrong even in the long term also. So even at the earliest phase of the time, if you notice something, the child is off to something, you should definitely bring to the pediatrician.
All right. And doctor, when you said pediatrician, so I also have this doubt, which doctor should be consulted? Because most of the time parents don't know whom to take their kids to.
Right.
So if they take their kid to a psychologist or a psychiatrist, that could be like a trauma for the kid again.
Exactly.
So whom should we meet first, and which doctor or which specification?
Yes. The first point of care should be a pediatrician.
All right.
Okay. He will look on to not only the psychological things, but the overall profile he can assess. Suppose if there is really any need of a clinical psychologist, then doctor itself refers to that person. So you don't need to fumble upon, and you don't need to cross-check with some other persons. You just simply visit a pediatrician if something goes wrong, and thereafter he will look after.
All right. So it's like a short time. Yes. You have shared a lot of things. Now, if you really want to get in connect with doctor, please get in touch with Brite Medical Center. And also, having said that, let me remind you this: if at all our kids have any sort of issues, any such kind of problems that we discussed, please make sure that you consult a doctor, because they are the voice of our future and we should pave way for their future.